pain like sciatica can be brought on by anxiety and stress. Hi, this is Dr. Chris Carlo, Doctor of Acupuncture with the Acupuncture and Herbal Medicine Clinic. And today's natural health tip that I want to talk about is chronic pain like sciatic type conditions and how anxiety and stress could bring that sort of pain out, bring it on. So maybe you're not aware of what sciatica is, so just to keep it simple, the sciatica is a nerve pain. Okay, there's different types of pain in the body. You can kind of think of it in a simple way like joint pain or muscle pain. There's nerve pain, and nerve pain often radiates, it extends out of an area. So sciatica is anatomically, there's a nerve that's coming out of the low part of the back, actually into the sacral area between the hips on the back side, and these nerves go down the legs. And when you have sciatic type pain, that nerve is inflamed and swollen and irritated, and you can feel that pain all the way down into your feet. Different people with this condition can experience it in different ways. Some people may just experience it in the low back and into the buttocks area. Some people, the pain will extend down into the thigh. Okay, and some it may go down to the calf or all the way down into the feet. So it can vary as far as where it's being felt. Sometimes the pain will wrap around to the front part of the leg, into the thigh or the groin. The thing to understand, the point that I wanted to make with this video, and when I talk with my patients who have this condition, is there's two things to be aware of. You know, when we're dealing with self-care and even healthcare in general, just trying to work through health issues that we're dealing with, it's important to be aware of what's going on. Then you can select preventative measures, right, or practices in prevention or treatment to experience some good benefits. But if you're not aware and you don't know where to begin, it can be quite confusing. That's why you seek out professional help, right? Anyways, let's get back to sciatica and how anxiety and stress could be a factor here. Some people actually physically may have some stress in a physical sense and hurt themselves or overdo it and experience sciatica. But I notice a lot of times in my clinic when I ask patients, you know, how's their life going? You know, they feel like there's a lot of stress going on. And oftentimes that is a factor with sciatica. Think about it. This is a nerve pain. What do we feel with? We feel with our nerves. The nerves are the very anatomical structures in the body that give us information. They go directly to our brain. They send pain signals. They send feelings, right? That's what you feel with. And if you have a lifestyle that's very busy, you know, the mind, there's a lot of stuff going on mentally, a lot of multitasking, a lot of anxiety, stress, just busyness, right? Mentally, emotionally, very unsettling, very irregular, right? Not smooth, not consistent, not just day to day, very common. It's more like irregular, unsettled, on the go, busy, 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 right? This wears on the body, and particularly the nervous system. The body's breaking down through stress day after day after day. Eventually something's got to give. And sciatica could be one of those resulting conditions. Now, how to treat it? There's a lot of therapies out there that are helpful. I offer acupuncture with electric stimulation that can help reduce inflammation and pain. There's other therapies like chiropractic, physical therapy. I personally don't like to lean on pain medications. And of course, surgery is always like last resort when all else fails, but I don't even want to go there right now. So let's just talk about therapies and their success. Sometimes therapies are not so successful because we're not really addressing the root issues. And a piece of the puzzle here with sciatica is nourishing the body. Through all that stress, it's depleting the body's resources of nutrients and all sorts of things that the body needs to function. Blood flow and hormones and all sorts of chemicals that are really involved. Every day the body's like breaking down and needing to repair, right? We get active, the body breaks down, we rest, we sleep, we eat, the body rejuvenates. Okay, and when things start to swell up and we get pain like sciatica, there is a blocking of blood flow. It's obstructed through this tissue. The tissue's not going to be able to feed. It's not going to be able to breathe. The blood brings in oxygen and nutrients, and then it takes away toxins. Every cell in the body makes toxins, and every cell in the body needs to breathe and eat. And a key to good health, good natural principles, is to promote good circulation. That's what I work with when in regards to acupuncture as a therapy. I'm trying to promote circulation through the affected tissue in the body. What needs to go along with that is good nutrition to feed that part of the body that has been worn out and beat up. Okay, so what is a key, the question should be, what are some key nutrients that could be helpful? When we're talking about chronic pain, there's a lot of inflammation. So learning about how to have an anti-inflammatory type diet, a diet that will reduce inflammation, will be important. And to keep it simple, sugar and weight-gaining type styles of eating and food are going to lead to swelling and weight gain, right? And blowing up, kind of, if you will. And then things that are like help to thin out the blood, if you will, like vegetables. Very fibrous. We can't digest the fiber, but there's a lot of micronutrients in the vegetables. You might have heard of antioxidants. This is oxidation is a breaking down process in the body, and if we eat antioxidants, we try to diminish that breaking down process. So lots of colorful vegetables are going to be helpful. A reduction in sugar and starches are going to be important. But here's a key thing. A key thing for the nervous system is B vitamins. B vitamins are very volatile, meaning when you eat foods that have B vitamins, they tend to get destroyed easily through the cooking process. And so oftentimes a lot of foods don't give us a lot of access to those B vitamins that we need. It's good to supplement. There's certain nutrients out there that are important. Everybody could supplement them, and one of them is B vitamins. Now there's different B vitamins. You might have heard of B12, B6, and so on. The key here would be to get a complex, a B complex that has all the B vitamins in them. Okay, B vitamins are really nourishing for the nervous system, and that would be a key part of therapy. So if you're dealing with chronic pain, particularly sciatica, and you're looking for treatment, some support, think about therapies like acupuncture, for example, but make sure you try to go a little further and get some info about your diet, get some critique about that, so that you can make some changes that would be supportive, so that it would support the treatment and it would result in a kind of quicker turnaround as opposed to a real sluggish kind of outcome with the effects of the therapy. Think about that. So if you got any questions, leave some comments, share and like, spread the word. I'm so focused on what is natural for the body, okay, in regards to healthcare. So if this is something that you find worthwhile and valuable, like I say, share and like. Appreciate it. Keep on the sunny side. Until next time.